Could your pigmentation be incurable? I'm Dr. Saleena Zimri. I'm a cosmetic dermatology doctor of 15 years, and I'm about to tell you possibly. Depends what type of pigmentation you have. So we're going to discuss 3 types today: melasma, post-inflammatory hyperpigmentation, and sun damage related hyperpigmentation. So we'll start with melasma. Yes, ladies and gents, melasma is incurable. It is a chronic condition, which means if you have it, you tend to have it lifelong. Although you can clear it, it does tend to come back. So maintenance lifelong is really important, but also prevention. Melasma is a clinical diagnosis, which means it's something that we see on the skin. We look for certain patterns and we diagnose it that way. It's very rarely that we need a biopsy or any further testing for it. There are 3 types of melasma. One is epidermal, which is in the surface layers of your skin. Then there's dermal, which is a little bit deeper. And then there is a mixed picture, which can be a little bit of both. Now, as you can imagine, surface right in the epidermis is generally easier to treat. But when it gets into those deeper layers, then it becomes a little bit more stubborn and a little bit more resistant to treatment. Some of you may have this, some of you may have seen it in others, and it's usually almost like a mask across the face. It can affect the cheeks. It's usually what's called bilateral, which means it occurs on both sides. And it can go across the nose, cheeks, forehead, around the mouth area, almost like a mustache, but usually spares the middle. And it can also occur around the jawline. Tends to affect women mostly, but can affect men, and it's usually the 20 to 40-year-old age. So what causes melasma? Well, what we know is that there is usually a genetic predisposition to overproducing melanin. Now, there are other risk factors or things that can trigger melasma or make it worse as well, is things like UV. So sun exposure can trigger it. Hormones, so anyone taking progesterone or estrogen containing medications can trigger. Pregnancy related hormones, so we call it the pregnancy mask usually. Other medications, there are other medications that can trigger melasma as well. Perfumed products, we know there's now a link for perfumed products that can trigger melasma. And other things can be just if someone has a simple family history of melasma. We'll move on to how to treat melasma. Now, this is usually a bit of a journey, and it also depends on your skin type. So lighter skin tones tend to tolerate a wider range of treatments than a darker skin tone. This will depend on your skin type, your skin tone, your skin quality as well, and what type of melasma you have as well, whether it's a mixed picture, dermal, or whether it's epidermal. One of the other features of melasma is that it is more prone in darker skin types, or skin types that tend to tan more easily. So again, with those kind of skin types, we have to be very careful with heat type treatments such as lasers. But generally, melasma doesn't respond very well to laser type treatments anyway. Basic principles of treatment, so SPF every day throughout the year, and a tinted one at that, because we know that melasma can be triggered by visible light. So using a tinted SPF is really important because it helps to block out visible light, as well as the UVA, UVB. Hats, covering up basically when you're out and in especially sunny environments on holiday, that kind of thing. And then stopping any medication that could potentially be triggering it. Or seek medical advice to make sure that you're doing it correctly and whether there are alternatives that you could possibly take. And then we'll move on to kind of in-clinic medical type treatment. I find that topical treatments tend to respond very well to, or better to melasma. That's not to say other treatments don't, and actually if you look at the research, it also agrees with that topical treatments tend to have a better improvement with. So when I say topical treatments, it means prescription type creams. So they could be things like prescription retinols combined with prescription hydroquinone. So hydroquinone is a lightening agent that helps to reduce melanin production and lighten up melasma. These are things that you can't use long-term forever. You can use tretinoin, but hydroquinone, we don't usually advise that for several months in a row. We advise to take breaks in between. So again, seeking medical advice and going with a good plan so that someone's overseeing your journey of using these products is ideal. Peels are a very good source, things like TCA peels, retinol peels, kojic, mandelic acid, those kind of products are excellent as well. There is some good literature on tranexamic acid orally, and some limited data on injecting tranexamic acid also into the skin. That could be a treatment as well. When it comes to laser type treatments, if it's very, very superficial and in a paler skin type, it's sometimes possible to clear that top layer and remove the melasma. However, deeper dermal pigment doesn't tend to respond well to it and actually can make it worse. There are other lasers now, things like Q-switch pico lasers that work in a slightly different fashion and can break up the pigment in the dermis, and they have some good success rates. So there is that. But again, have to be more cautious in your darker skin types. And then there are other products, so over-the-counter things like retinols, mandelics, tranexamic acid, just things that you can get over-the-counter in a skincare product. Obviously not as strong, but some people find them beneficial, and it helps perhaps more in maintenance rather than in initial treatment. So these are the kind of products or ingredients that you want to be looking out for when you've got a daily skincare routine and you are someone who suffers with melasma. So let's move on to sun damage. Sorry, I realized I wasn't wearing my mic, but I wasn't going to record that whole thing. So hopefully this is a bit clearer. But sun damage. Now, this is that typical kind of freckly look, sunspots that you can get. They don't tend to be like equally placed and on both sides. You might have a few on one side and a few on the other. It might make things like your freckles deeper and darker. You might have broken veins on the skin, more chance of fine lines and wrinkles, that kind of thing that basically contributes to aged skin, and that generally occurs from photo damage, so sun damage. But we're going to talk about the pigmentation element of this. So I'm not talking about your natural freckles that you're born with. I'm talking about freckles that come out through excessive sun exposure and individual sunspots that sometimes can predispose you to also skin cancers. So they're always worth checking out if you're unsure of new pigmented lesions on your face. So treatment, obvious things first, reduce your sun exposure, wear SPF, cover up if you're out in excessive sunshine. So hats, long sleeves, that kind of thing, because pigmentation doesn't just occur on the face, it can affect your chest, hands, arms, everything else. In terms of treatment now, usually I would say start basic. So make sure you have a good skincare regime that includes an SPF. And you could do things like vitamin C topically, retinol. Those kind of things will help to repair and improve the quality of your skin and repair some of the sun damage. If it's excessive or it's substantial enough, you can then move on to in-clinic treatments such as laser. And there are some fantastic laser treatments out there. One that we do in clinic is something called Photofabulous, which is a combination of IPL or intense pulsed light laser, which helps to pull out pigmentation from the skin and then comes off the skin. And it can also, the filters can be changed. So if you have a bit of like broken veins and redness from sun damage, we can also treat that. Then the second part of the laser is a resurfacing laser, which helps to renew the skin, improve the skin quality, and again, resurface some of the old sun damage that you have on the skin. Can be used on the neck, décolletage, and also the body in general. From moving on from lasers, you can then have peels. So TCA, retinol peels, they're fantastic treatments usually for some sun damage, and they tend to really basically lift that top layer of skin off to reveal fresh, newer skin. You can also have some at-home peels, which are usually a milder strength, but they certainly help with improving skin quality overall. Sun damage is something that it will take, a bit of a process to improve and to really turn over that skin and really help to improve the quality of your skin long term. So it's a bit of a commitment, but with the right treatments and with the right skincare, you will absolutely get there. And then other things too you can consider as well is microneedling to improve skin quality, radiofrequency, and they're all things that can help to reverse signs of sun damage and pigmentation. Take-home message with that is obviously make sure you get consultations when you are treating any kind of pigmentation on the skin to make sure you're using the correct products for your skin type. But when you're looking at skincare, the key ingredients to kind of look for sun-related hyperpigmentation are things like vitamin C. They're an antioxidant, but they also help to brighten up the skin and lighten sunspots. You can look out for things like azelaic acid, retinol, again, turnover improvement. You can look out for things like tranexamic acid topically. Again, milder evidence with that, but is still a helpful product topically if you're using that. kojic, mandelic acids, those kind of things, TCAs, AHAs, BHAs. They're the kind of things that you're looking for in if you were doing milder peels or in actual skincare products as well. So I hope that's helpful. Obviously, drop a comment if there's anything else you wanted to ask. So post-inflammatory hyperpigmentation is usually pigmentation that you get post an inflammatory process on your skin. So things like acne, burns in general. So it could be from accidentally burning your skin with a hair iron or from a laser in clinic, or it could be from picking at your skin. It could be other trauma. So again, cuts, bruises, that kind of thing. And could be from scratching the skin. That's another form of trauma. But again, it tends to leave. So the skin heals, but it leaves behind a little bit of hyperpigmentation. Tends to look worse in the darker skin types. So real kind of more browny pigmentation. In a lighter skin type, so skin types 1 to 3, they can look more pinky rather than brown. So again, like a post-acne scar, you might get that kind of pinky hue rather than more of a brown. But again, related to what we call post-inflammatory hyperpigmentation. Now, in terms of treatment, well, one is curing the cause. So making sure that you have your acne well under control, because there's no point, but if you start aggressive treatment for post-inflammatory hyperpigmentation and you're still breaking out, then you're going to be in a constant process of just a repeat cycle, essentially. Treatments wise, so obviously skincare, SPF, really protect your skin because that can promote or make your hyperpigmentation worse. So sun exposure can do that. So wear your SPF. Skincare wise, again, it's those brightening and lightening agents. So your vitamin C's, your retinols, your AHA, BHAs. In clinic, peels tend to do a very good job. I like combining microneedling because it also helps to improve any scarring left over. So microneedling combined with peels to help to really lift the scars and improve the pigmentation as well. Lasers, again, depending on the skin type, lasers can be really helpful. Things like CO2 lasers to help to improve skin quality, pull out the pigment, but also help to resurface any scarring that you'll have left over from any of the causes of the PIH. And then other things, again, so you can do some fractional radiofrequency, which can help to improve collagen and help to improve quality of skin and any discoloration. But again, making sure products that you have at home contain those kind of ingredients is really helpful and will improve your PIH. So I hope this round of hyperpigmentation related information was good. And if you found it helpful, please comment. If there's anything else you want me to add or any questions that you have, please comment and like. Also, just try your best to seek medical advice. Really get yourself on a plan if you have any of those conditions or you want advice on how to start skincare. It's really, really worthwhile even just making a plan for the year if you have these types of treatments, especially if you have melasma, because it is such a journey, and it's something that just you need sometimes a bit of hand holding with, and you need repeat sort of consultations and follow-ups just to make sure that you're on the right path and things are improving. And the next topic I think I'm going to do on rosacea, so stay tuned.